So Dr. V.C. Mehta will enlighten us on this.
Good morning, everybody, and good morning especially to Dr. Kumar. Please get up. Your slides are very old. All the halos and glare are of the past, not of the present. So, a young computer executive with cataract, whether EDOF or trifocal, my dear friend has opted for an EDOF lens. Obviously, a complete preoperative workup will be done, and if the patient is found to be suitable, then my choice would be a trifocal, because the visual needs of a computer executive is not just the intermediate vision. Quite often, they shuffle between the computer and the mobile. And therefore, you cannot ignore the fact that near vision is equally important as much as the intermediate vision. My dear friend has conveniently left out the fact that to read N6 you need plus 1.5, and you certainly addressed it without most of the people realizing that. So my choice is trifocal because it gives distance, intermediate, and near vision. I don't know why you don't choose a trifocal lens. Is it because are you afraid of halos and glare? To remind you that the occurrences of dysphotopsia with the trifocal lenses is significantly low in one of the series of the lenses, and I'm sure most of you people would also be having the similar kind of thing, provided here is that you select your patient well and you achieve exact emmetropia. If you are left with certain amount of refractive error, you are bound to get some kind of a dysphotopsia. So dysphotopsia is not really happening in the present lot of trifocal lenses. It was there in the previous years when you had a Restore Plus 3 and all those lenses. And even the contrast vision is very good. Both the photopic and scotopic visions are not affected much in the present day trifocal IOLs. EDOF does not give you a full range of vision, Dr. Kumar, and what you miss out is there's something is missing out. There's definitely something which is missing out, and that missing out point can only be completed by the trifocal lenses, which gives you a full range of vision. And remember one thing, Kumar, remember one thing, and that is you are missing out on N6, and that is what the patient wants. Thank you.
That was a superb presentation, Dr. V.C. Mehta, sir. So the fight continues, trifocals versus EDOF. Dr. Anurag Mishra, welcome to the debate, and your comment, please.
So
this was on EDOF versus trifocal in a young computer executive.
Yeah, so comparing the two platforms coming in from arguably the #1 IOL manufacturer in the world, I've had experiences. They do stand out exactly as points put forward by, I'm sure, both of the, I missed a large segment of that though. However, there is just one thing that I would like to bring to the notice of the esteemed house here. To my experience, the EDOF in 1 in 50 patients, and in particular, and I found this to be essentially in the less than 40 age group, does behave just like a monofocal. It does not give you anything even for intermediate. I have found this in 2 of my patients, and I was a little surprised. I have noted it to the company as well. So I had to choose a trifocal for the other eye when the patients came in. So, and so that's the reason why the reasons are known to me, the reasons are known to them as well. So we just need to be careful about that 1 in 50 possibility of this behaving like a monofocal.
So I think each patient is different. We need to cater to the needs of the patient. A patient would probably, what we are talking here is a young patient, a patient who needs computer work. So it's a very specific scenario. So in such patients, what they need is basically intermediate vision. Yes, he may be driving because he's young. Yes, he may be also looking at his mobile where you use more of near vision. So today mobiles make a very important part of our lifestyle. So I think in today's scenario, no matter what the patient says, It is good distance vision, good intermediate vision, as well as good near vision that we all need to give. Glare and halos is something which is now probably much lesser compared to the older yesteryears. And with the EDOF lenses, definitely I think they have improved. Dr. Haldipurkar sir, in your experience, which of the various EDOF lenses, so we have no financial interest whatsoever, all of us. So which EDOF lens would you prefer and would you think gives the minimum glare and halos?
Well, I think those the Proxa,
The
Mini-well.
mini-well, yes.
Mini-well, that
Siffy.
probably is a good lens, but my personal practice is very minimal on that based on VBT, and VBT I found to be extremely satisfying.
Yeah.
Except that
yes, sir.
it may not take you here, but Proxa can do it.
Proxa, because it's the other eye which gives you
Proxa
near
has
vision.
3
Yeah.
zones instead of 2.
5
so that's
zones.
5 zones, yeah.
The
5
mini-well
zones.
has 3 zones, the Proxa has 5 zones. Yes, yes, yeah.
My practice for these trifocals has been very limited because I'm very conservative about it. But nevertheless, in the last 6 months or so, 4 months, I have tried VVT, no financial interest whatsoever, in compulsive eye trifocals in young adults also. And the results are more than expected.
Point. Hands down.
Yes.
Absolutely, sir.
Absolutely.
Dr. Boramani, sir, you wanted to say something?
Yeah, same thing.
There is a new lens, the research of Dr. R.C. Shah and Dr. Jagdeep Kakadia, autofocus lens. This is a polyfocal lens in a true sense. All our multifocals, trifocals are either bifocal or trifocal. But this Dr. R.C. Shah's research is a true progressive intraocular lens, and it is independent of pupil size, independent of angle kappa. You can put it in diabetes also, and whatever compromise you are having for near vision in the EDOF, that is also not required. It gives a full range of vision, and if you hold the lens against light, it looks like a monofocal. There are no rings. There are no rings in the lens. And you mind my words, mostly all of us are going to put these type of lenses
So,
in future.
yeah, you're very right. So, the diffractive platform basically cuts off 18 to 20% of the light because of, and gives rise to glare and halos. Things like mini-well work on the principle of spherical aberrations, and there are no rings, and probably that is why the glare and halos is less. Yes, sir.
No, I was going to say the same thing as Jagannath said. Same thing. Even I'm using those lenses. Excellent. Excellent. I think
Yeah.
probably, as he said, the future is going to be that lens.
Thank you.
Jagannath is there. Dr. Sao's here. All of us are using it. It's fantastic.
Just one point to make it, at least a mix and match, I think, is the best option, because whatever you do, as Madam said, it cuts on some say 18%, even if it is 10%, you miss out on a little bit of contrast sensitivity. Well, I don't want to, experience needs to be done, it has to be
Yeah.
put on horizontally. It cannot you just, and no, there's no toric option also as of now. Anyway, it needs to be seen.